precautions. Stay safe out there.
Right now, turning back to the coronavirus here in Connecticut, we are definitely seeing an uptick in cases all across the state. Yesterday, we reported the positivity rate hit 2.4% for the first time in months since over the summertime. Joining us this afternoon to talk more about how concerning this is Dr. Henry Anyamadu from the from the Hospital of Central Connecticut, I should say. Doctor, thank you very much for taking a few minutes to talk with us.
Thank you for having me.
Let me ask you first, why do you think we're seeing this increase right now?
You know, the transmission of COVID-19 directly correlates with increased human activities and increased human activities all over. And as we see our businesses opening up, our schools are increasing capacity, restaurants are opening up as well, it's only natural that we'll see a lot more cases of COVID-19 and outbreaks here and there.
So obviously I'm thinking, because we're having cooler weather right now, that this may be a factor as well, because it's sending people inside more than they were perhaps going over the summertime?
That is true in a way, because we know that lower humidity and cooler months definitely increases respiratory illnesses in general. Respiratory viruses do increase in cooler months and with lower humidity. And the rationale is that people end up spending more time indoors than outdoors. So that's a concern too. I know that the governor had said they don't want people to panic. Should people be concerned? I'm thinking yes. Concern, yes. I think we need to be concerned. We don't need to be panicky at this time. Yes, especially going into the next 3 months, because we know that the next 3 months are going to be cooler. And we know that the virus will increase, the spread of the virus will increase going into the cooler months. But we need to be vigilant, and we don't have to undermine all those mitigation strategies that has kept us all this while. Because if we don't, then we risk the lives of many people. We have to keep physical distance and continue wearing masks and washing our hands.
Okay. Very good advice there, Dr. Henry Anyamadu. Thank you very much, from the Hospital of Central Connecticut. And again, we appreciate what you're doing every day and what your coworkers and nurses and all the doctors at the hospital are doing to keep everybody safe and healthy.